This is a quick video to give you an understanding of what you need to know about health sharing programs. It is a great lower cost alternative to Obamacare. It is the ability to replace the high insurance costs for health coverage and go another direction that will save you thousands of dollars. Health share programs are organizations that provide the sharing of healthcare costs amongst their members who share common religious or ethical beliefs. These are 501c3 programs, nonprofit, that help share the costs of healthcare amongst its members. It is not health insurance, but it acts like it. Health share programs have been around for over 30 years, and the membership in the United States have skyrocketed since its inception because of Obamacare, because people were forced to find other alternatives. But this one is rarely heard of and rarely taught about, so that's why we are doing this video. Currently, over 1 million people in America are members of health share programs. They have shared over $1.5 billion in healthcare costs amongst members to make it affordable for them. Now, you're probably wondering, why do people join health share programs? Number one, it is much less expensive than Obamacare plans. 30% to 50% range is the amount of savings that these things are generating for people. It also allows you to be exempt from tax penalties. Under the Affordable Care Act in Section 1501 in page 148, it shows specifically about health share programs. So therefore, if you are in a health share program, you are exempt from Obamacare. The other added advantage is that it has bigger networks of facilities, doctors, and different organizations to partake in getting the pricing of healthcare lowered. I have one organization that their average claim that is put into them, they negotiate it down 86%. So you tell me, what do you think that does to premiums? It's much more in your favor. The other thing is, you don't have to pay for coverages that may be opposed to your beliefs. For example, abortion, things like that. You may not like it, but it's still legal. But you don't have to partake in it in this kind of program. Telemedicine is also included in these health share programs. What are the differences from ACA plans? Well, pre-existing conditions are not covered for 24 months. Cancer cost sharing is also not provided for the first 12 months. There is no sharing mental health or substance abuse claims. Also, there are much bigger networks and more access to healthcare because of these type programs. Here's the added advantage. You can enroll for these programs all year long, not just at the end of year for the beginning of next year. Not going to work with this. This does it all year long, so you have the ability to lower your costs immediately. What is the bottom line for health share programs? Number one, it's the law. Number two, it gets the government out of your business. That way, they are not standing in the way, forcing expensive insurance down your throat. This gives you the ability to lower your costs 30 to 50% immediately. The networks are very large and give you the ability to choose which doctors, which facilities, and hospitals that you want to use. This is health coverage you actually use at a price you can afford. If you would like more information, contact your healthcare benefits advocate.